Hey, week two, we are here already, and I'm telling you, it's going to go by very, very quickly. This week, we're going to go over chapters 31 to 33, infants, toddlers, and preschoolers. It's all the little kids. And I'm going to show you how to work with them, how to get on their level, and having children sit down and let you do things to them. I worked in an ER for 10 years, as I said. I worked a lot in like the less urgent area because the young nurses wanted the trauma area, right? So if there was a bad trauma, yes, I'd be called into it. But overall, I just like in taking care of kids, the sore throats, the influenzas, upper respiratories. And I got 5 kids on a team, which means all day long for 12 hours, and I worked all the weekends. I would have to walk in a room, be able to get on that child's level, be able to do nose swabs, IM injections, start IVs, draw labs without a kid going crazy and spending all my time. How did I do that? Well, I've learned how to get on their level and to make it more of a game and less of punishment and pain. Okay. So that's what I'm going to teach you. And you could take it whichever way you want and use it. It does work if you do it, what I'm telling you. Now, next week is Martin Luther King. There is no class. Now, there is a scheduled quiz. So that is week 3. Week 3 is also the week for exam reviews. Now, by Friday, Saturday morning, the latest, I'm going to be posting next week's review of all of the pediatric professors, their Zoom numbers, the day and the time where they're going to do a review. Now, I haven't scheduled mine yet because I wanted to ask you, is there a day during the week that's easier for you to have a review? Next week, this is week 3. What day of the week works better for you if you wanted to come to a live review? Remember, they're always recorded. You always are going to get them. But many students like a live review. What day of the week is good?
For me, it would be Thursday.
Yep, Thursday.
Third, 4 o'clock? 2 o'clock?
Thursday.
What time?
Thursday, 4 o'clock sounds pretty good because I have to work in the morning.
Okay, 4 o'clock. Everybody good? On a
Clinical
Thursday?
No,
Fridays.
no, we got community.
Yeah, we have an entire class that day.
At what
And the
time do
Sims
you
that
have?
morning.
And the Sims, yeah.
I
Are
mean,
you
I'm going to
gonna
flip all the
post it?
reviews. I have 3 exams,
I
and
like
I'm
to
going
be
to
there.
switch them all around. And
Oops,
remember,
sorry,
you
y'all.
will always get the recording, and
Oh,
I
that's
post
fine.
them extremely quick. All right, I do the recordings, and it's immediately up on my YouTube channel, even before any of the other class gets it. In fact, many of the other students from other classes know that and are already into my review before even the professor gets it onto their announcements. Okay. All
Yeah,
right.
as long as I can see the recording, because everybody is not going to have the same schedule. So,
No, it's true. I mean, but if you want to do it, we'll start out with Thursday, 4 o'clock, and next exam, we'll figure another time. Whatever works for you, I will work in your schedule if I'm not teaching something else. So, okay, very good. Now, because we didn't do the quiz next week, what I'm going to do is have the quiz right after the exam. It's the same information. Is that okay with you? All right. Again, it's a quiz like you just saw. It's going to be information that you know. And you just have to think, make sure you're answering the right question. All right. One of the other things that I did see in the discussion questions, I clicked through them before class today. I noticed that references weren't put in some of them. Now, when we do discussion questions and you're writing about, okay, yourself, you don't need a reference. You know yourself. But when you started talking about nutrition and the importance of nutrition, where did you get that information from? Yes, I know everybody has all this in their brains, but in order to write it down as um, scholarly, it must have a reference. So it just put the book down, Perry, right? That's your book. You could put it, but it's a reference down. Now, This is in your initial post on discussion questions. You must have a reference, or it is 4 points off the whole 20 points, okay? And you're going to see that. I put 20 points for everybody else who had a reference because this week there's so much mumbled jumbled, people moving in and out of classes. I'm not going to mark you off with all the movement. Starting for your discussion question 2, I'm going to go into things like you didn't cite in the body of the paragraph your reference. So if you're talking about nutrition and how it affects infants, and you're talking about the book, it would be Perry et al., 2023 at the end of the paragraph, at the end of the sentence. Okay? So if you don't know how to do that, let me know, because you have one paper that's due and it is APA format. So I'm trying to help you get to that paper on week 8. And again, you need help with it, let me know. I know that you're busy. I'm not, if you want to come on Zoom for 10 minutes, that's fine with me. I'm not going to hold you for an hour if you come to me. I know your time is just as precious as mine is. All right, so let's go ahead and let's start today. Any questions so far? Start thinking about what diagnosis might excite you to do that assessment project, okay? That assessment project is due work week 8. It's 3 portions. So you've got a paper, you've got that handout of the assessment, and then you've got to think of what you're going to teach your child. So start thinking about a diagnosis and let me know. Remember, I must approve your diagnosis, all right? All right, so week 2, infants, toddlers, preschoolers, literally, we're going to go from ages, at birth, and we're going to go all the way through preschoolers, which up to age 6, and 6 starts school age. Now, we've already talked about infants and how quick they grow, right? They grow quick, it's very dramatic, it's fast growing. And we know that if infants aren't getting proper nutrition, we're not fueling the tank, and they're not going to be cognitively aware. And even their fine and gross motor skills are going to be delayed. That's why we look at height and weight every single visit from a pediatric visit, always. When we know babies are born, we know they lose up to 10% of their body weight, and then they start gaining it back by week 2, and it's 5 to 7 weight gain per week. We should double birth weight by 6 months. This is a quiz question, and triple by 1 year. Okay. What's interesting is every month for the first 6 months, they grow 1 inch. So can you imagine? You're doubling your weight, you're growing an inch a month. You're not feeding this. Guess what? They're not going to be growing the way that they should. And then, of course, you're going to see it cognitively. They're not going to be as smart as they should be, grasping things and motor and rolling over and lifting head, et cetera, et cetera. Now, when babies are born, you were given that vital sign sheet, and we know they start out with a heart rate of 140 to 160. We know the respiratory rate is 40 to 60. These are neonates. This is at birth. And as we get older, we get to that adult vital sign, right? 60 over 100 is your adults, right? And your respiratory rate, 12 to 20, is always what I remember from being those adult normal vital signs. It gets slower and slower and more efficient, more effective as we go. Now, one of the things you have to remember about infants is babies are born with mommy's blood, mommy's antigens, mommy's antibodies, mommy's iron, mommy's everything, but it doesn't last. It tends to die off, right? Just like regular red blood cells die off, and the iron, it gets used and depleted. So infants do suffer from anemia from about 3 to 6 months. It's not uncommon to be born with a hemoglobin of 14, and then by 3 to 6 months, you're down to 9 or 10 hemoglobin. So you can see how much cells are growing off, and they are going off. So we need to get iron, because what is blood? What is hemoglobin? What does it carry? It carries oxygen and it carries iron. So if you don't have blood cells, iron's not getting to the body. And again, you need iron for good growth. So that's why we do supplements. Now the head. There was a question regarding anterior fontanelle on that question. Now, very good concept. That fontanelle in the back, posterior, by 6 to 8 weeks, it's closed. It's gone. We don't really need it. It's just there at birth for extra room for that brain to grow. Now, the anterior, the one on top, that soft spot up there, it doesn't close to 12 to 18 months, and it's absolutely normal. So if you're seeing that, the fontanelle at 18 months has closed, well, that's normal. Or the fontanelle is open at 18 months, that's not normal. These are concepts that you're going to see things about. Another thing is babies are born, and each eye works differently. It's called binocularity. You have the binocular on this side and on this side, and they don't meet. So they get a little bit dizzy when they try to reach things because it doesn't pinpoint because those eyes don't work together. So that's depth perception. And that usually gets to better about 9 months old. As I said, immune system comes from mom, right? And guess what? They wear off and go away too. So if you've looked at the book and you've looked at the immunization schedule, it's a 2-page, how many immunizations do I need to know? Well, what you need to understand is that babies are born with mommy's immune system, and it's our job as mothers, if we are parents, to get our children immunization status, as well as we can to prevent diseases that there's immunizations for, okay? So they're given at 2 months, 4 months, 6 months, 12 months, 18 months, 2 years. I mean, we're giving them like crazy. So children tend to not like nurses when they're very small because what do we do every time they go to the doctor's office? They give them a shot, they give an injection, right? Hold them down, let them scream and yell. And that can be part of it, all right? Now, we know that there's all different things that could protect the baby. We know that breastfeeding and breast milk gives extra protection to that baby. Mom makes antigens. Let's say there's a little cold in the house or she is a little cold. Well, her body's making antibodies against it, right? It comes out in the breast milk and then the baby is protected from it. And that's the benefit of breast milk. Also, decreased SIDS death with breast milk. Now, birth, you ever notice if you've ever had a child or been at a delivery, they take the child out immediately, start drying them off, and put them underneath a hot radiant warmer. And why do they do that? It's because they can't regulate their temperature at all at birth. They got all this fat and they've got their whole tissue is just swollen up with fluid, right? A lot of extracellular fluid because what does a baby do inside mommy? Floats in fluid. They do soak up that fluid. So what we do is we can send that baby I swear it happens like this. You see the baby and they're all puffy and you don't know if they're cute yet. They go to the nursery, they bathe them, they urinate a couple times, the swelling around their eye go down. I'm like, oh, that baby is so cute now. And it's just that getting rid of that little extra swelling that's gone on by that fluid that they have been soaking around with. Now, prehension, grasping objects, palmar grasp, and then there's pincer grasp. Now, fine motor skills, very important. It's part of developmental stages, part of things that we need to be monitoring as nurses as part of their assessment. So what is fine motor? F, fingers, anything that does with the hands. So grasping objects, it's a palmar grasp at first. Ever, if you've had a baby, you put your hand in the crib, they take your finger and they hug it, and you're like, oh, look, my baby's hugging me. Well, that is a reflex. It is not voluntary, okay? Initially. Eventually, it becomes, yes, I want that finger, and I grab it. So that's palmar grasp. And that's all the way up to, 5, 6 months. And it becomes that reflex into voluntary. And then it starts with what we call pincer grasp. All of you've done it or seen it, little baby in a high chair with little beads of Cheerios or puffballs or whatever it is of, today, and they take and smush their hand and smush it in their face. Now that's a crude pincer grasp. Then it becomes, let me take one at a time, and I'm going to have a fine pincer grasp, one little thing at a time. Now with their hands, at 11 months, they can take like blocks out of a container. And by age 1, they should build a block of 2. It doesn't mean they don't build 3 or 4. Remember, all kids are different, but the minimum that they should have is a blocks of 2. And that's just a test for you. Now, gross motor. I like the pictures because it can actually show you. Now, the top right one, that's called head lag. Because usually when you pick a baby up, that top right middle one, you see how the head is coming with the hands, and the one in the top that it didn't come up, it sort of lags there. That is called head lag, that top right one. They should, by 3 months old, be at B, coming up. That's the head lag. They don't have head lag anymore. They've got neck control at 3 months. Between 5 to 6 months, they rotate from their abdomen to their back to their abdomen. And then the good old sitting alone, unsupported at 8 months. And then one of the biggest movements they start is they're on their back, and then all of a sudden they can scoochy themselves up and sit down. And that's by 10 months. That's a lot of work. Can you imagine an infant who couldn't even lift their head up is now getting off their back and sitting up for you within 8 months and 10 months, right? That's a lot to do. Their locomotion is cephalocaudal. Again, cephalic is the cephala. Caudal is toes. It moves from head moving, and then it goes to their feet, and they're walking or attempting to walk at 1 year old. They're crawling about 6 to 7 months old. Creeping is like they're up on a couch, standing up, moving around the couch, creeping around on their feet. Walking with assistance about 11 months, and maybe or almost walking alone at age 1. And as I said, my kids never walked at 12 months. My grandson never walked at 12 months. They never walked. They ran, all of them, at 15 months. And all of that's normal as long as they were doing all the other stuff. Okay? One depletion in development doesn't mean that they're behind. It just means that just want to need a little bit more time. And remember, children are all different. Now, nutrition for 6 months with a newborn infant. Babies are born and their GI systems don't work well. Therefore, they can only have either iron fortified formula or breast milk. They say breastfeeding should be 8 to 10 minutes on each breast. And the other thing that we need to know and teach our parents, especially if they were in the hospital for a while and they got bottles and they were measuring formula or breast milk, they're like, well, how do I know if they've gotten enough? I can't see how much they took. Well, 6 to 8 wet diapers a day tells me that they are getting enough to eat. Also, remember I told you they come in at right after birth, like at 2 weeks, they're there, 2 months, 4 months, 6 months. What do we do every visit? We weigh them. So how do we know that they're getting enough nutrition? They're gaining weight. They're gaining weight. And that's just telling you with the wet diapers gaining weight, they're getting enough nutrition. And cognitively, they're rolling over when they should. Their head's picking up, they're crawling, they're creeping, doing all the things within a normal recommended time, okay? Breastfed babies should get some vitamin D, and that's one of the only other supplements. When we do the iron fortified formula, they don't need it. As I said, the GI system is very immature at birth. You feed them, you're going to see that food in the stool, chunks of it. It's just like making the effort to eat, burning the calories, and getting nothing from it is basically what it is, okay? Now, 6 months. So what do we do? Well, we're going to have all these foods we can give, right? Well, they actually say this is the time we're going to start weaning from the bottle or the breast. And we're going to start introducing cereals, fruits, and vegetables. They say rice cereal is the least allergenic and should be the first sort of foods started. And then one food introduced every 4 to 7 days, only one at a time. And why one at a time? We're looking for allergies. Ever have a child with allergies that ate food at a young age? What do you think they would look like? You think maybe vomiting, gas, diarrhea, rashes all over, right? These are things that you might see. And if you're seeing an intolerance, we know it's probably that food. The doctor will say, put it on the back shelf, try all the other foods, try it again in the end. But it's one food every 4 to 7 days, and we're going to start weaning them from breast. Now, they say feed them food and then give them their milk. Because if you give them milk first, they're not going to eat their food. And we're trying to wean them off of the formula and breast. As I said, there's all sorts of food sensitivity. Many times it's rationing that's going on there. Again, it's being aware of it, knowing what to do. If there's a little rashes, let the doctor know. Sometimes my grandson is a tree nut. Give him a pistachio, and he's going to go into anaphylactic shock. Put a walnut in his mouth, and it's all of a sudden his mouth is blown up, and his throat swells up. So our kids at young age, and this is a very young age that we realized it with him, and he does carry an EpiPen around. But again, it's knowing food sensitivities, and this is the time that we find them out. Babies, hopefully by 3 to 4 months, are sleeping all night long. We know that first month or so, they're not sleeping. You're trying to get that circadian rhythm on when to sleep, when be awake. And we know that's a tiresome time for new mommies and daddies. Breastfed babies will awaken more. Usually breastfed babies are fed every 2 to 3 hours. Many times formula are 3 to 4 hours. So they do tend to sleep more, the formula babies. Of course, they have sleeping and they have napping. It's, they're awake a little time, tummy time, and then they're back to sleep. They're saying all of those cute little things that we want to get our baby, the walker, the swings, the playpens, they're really not necessary as an infant. So when they get older, that we'll need those stuff. Now, dental health. Toothbrush only, no toothpaste. They sometimes just use a wet wash rag and clean the teeth off if they have them, especially before they lay for nap or they go to bed at nighttime. Another thing is no propping the bottle. I know it's easy for a mother, it has all this stuff to do, prop a bottle, and what it does, it gets all that sugar sitting in the mouth, and that sugar gets on the teeth, it eats the enamel, and it can cause cavities. And that's why no juice, no milk, and to use a pacifier. I can't emphasize how much a pacifier is used. How does a baby seek they soothe themselves? How does a baby soothe themselves? With their mouth, always in their mouth, whether it's a finger in their mouth or a pacifier in their mouth, something in the mouth, it calms them down. So pacifier, when they're very upset, can really be a good thing. So how many teeth should they have? Well, my kids never had teeth at 12 months. They had teeth at 15 months and they got 6. They had nothing at 12 months. And there's some kids at 6, 7 months who have 2 teeth coming up. Again, they say it's a number of months minus 6 should be the type of teeth that you should have in there. So if 12 months old, you should have 6 teeth. Doesn't mean you do, but it's a possibility. Immunizations at birth, week of Hep B. And we have a bunch of other ones, and we're going to go through those as we go about the importance of them. Influenza is only given at 6 months. We don't give that newborns. And varicella is right around 2 years old. And remember, some of these are live vaccines, and you've got to remember that. and giving that to some of these immunosuppressed, even children and babies. Colic is a big deal. It usually goes away about 3 to 4 months, but it's a bunch of gas. And this is a difficult time for the child and for the family. This kid is always crying and cramping and gassy. We have kids who sleep a lot, who don't sleep enough. And then we have children, what we call failure to thrive. Now, just because they're getting formula or milk doesn't mean their body knows how to break it down and how to use it. And sometimes it's a metabolic condition like that that causes no nutrition to be getting to that infant. They're not gaining weight, therefore, failure to thrive. And that would take a child to be admitted and get a workup, find out what is causing that child not to be able to tolerate eating, and to try to figure out a plan to gain weight. Today, especially with Sid's death, right? Back. They have to be on their back at all times. And I think parents worry about that flat head in the back and the hair missing in the back, and they feel like they don't like that. Well, they have found through research, and they've done so much research on SIDS today, that if you put a baby on their back to go to sleep or naps, there's less incidence of SIDS death. So when you put them on their tummies, where they have an increased SIDS death, what also causes increase in SIDS death? Smoking. And they say breastfeeding decreases SIDS death. So again, more things for breastfeeding there. Now, you have a mother who has a baby whose head is flat on one side or on the back, called positional plagiocephaly. Remember, cephalic cephaly is head. What do we do and what do we tell them? Well, birth, if you've ever noticed, babies' bones are soft. Their heads are soft. That's why you have to be careful with them, right? So if we put this baby on tummy time several times a day, they're getting that pressure off the head. And it's allowing that scalp to round out. And in the end, they're not going to have that big flat back there. And it does work. Diaper dermatitis, probably one of the biggest conditions that'll keep you awake all night long. If you have a baby with a bad diaper rash, as soon as they urinate or stool, they're crying because it burns. So getting rid of that diaper dermatitis, diaper rash is very, very important to do. Whether it's having it open to air, creams, lotions. I had children that were allergic to certain brands of diapers, and that could be it. You don't know. So again, it's just trial and error getting rid of that. And then that cradle cap. Babies are born with that white, crappy, flaky sort of head. And we know little girls, we want little bows, and we don't want that little flaky stuff there. So how do we treat that? Well, we wash it normal, soap and water, but then we're going to lubricate it. Many times they say, put the mineral oil on, let's say, at night, and then give the bath in the morning, and then all night long it's lubricated. And then take a fine tooth comb and very gently comb the hair. And in time, all that white, crusty stuff will come off. As I said, SIDS is a big thing. I told you it's cigarette smoking. I told you it's sleeping on their tummies. We know that breastfed are less apt for SIDS than a formula-fed baby. Overheating. What if they've just had a little upper respiratory infection? Remember, infants, suck, swallow, and breathing is really hard. And they had to learn how to do that. Now you put a little bit of mucus in their nose, and guess what? They can barely breathe. So that is a big thing. And again, immunizations are a big deal. Using soft mattresses, they should be hard. And males are more prone to SIDS than females. Okay? So males, cigarette smoke, prone sleeping, overheating, no breastfeeding, and then if they've had this cold, this upper respiratory. Now, there's something that we call an ALT. It also can be called a missed or aborted SIDS death. And what it is baby could have been choking and all of a sudden turns blue and doesn't take a breath. And the mother comes and has to pat the baby on the back to get it breathing. And of course, they go right to the doctor, right to the ER, something happened, and they're going to be admitted with what we call ALT, apparent life-threatening event. Is it neurological or is it GI? Is it reflux? And they do a big workup for it. All right. Now, these children will be sent home with an apnea monitor. Now, apnea monitors are very easy to use. It's just this little Velcro strap with these two probes that go over the two breasts, and it monitors your heart rate and respiratory rate. And when the number gets too low, it is a piercing, horrible sound that goes off as an alarm, hopefully to wake you up and the infant up, startling them, okay? So apnea monitors. Health and safety, the biggest area that we know is the biggest injury prevention is motor vehicle. Always motor vehicle. Another question on the quiz, right? Motor vehicles are the biggest area where children do get hurt from. We know that parents should all know CPR. And, you know, I live in South Florida. So water safety for me and my children is imperative. You know, I've got a little, grandson, he's 8 now, but guess what? At age 2, he could do front flips and dive off a diving board and had absolutely no swimmies on because I was not going to have that child with his pool in my backyard have something happen. Furthermore, he will never go in that pool without asking permission first because he knows better. So Letitia is breastfed infant being seen in the clinic for her 6-month checkup. The mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? Well, let's go back to the question. 6 months old sucking a thumb, is that normal?
Yes, she might be teething.
It could be, absolutely. And again, isn't that how they self-soothe themselves? So it's actually a good thing. She found her thumb. All right, let's go into some theorists. And I'm telling you, there are many questions of these on your exam. So I will explain them again in the review. I'll explain them again, but let's just start with Erickson. Erickson is the people around them, okay? And how do I involve myself with the people around them? Well, an infant, how can I get my people around to pay attention to me? I cry, I coo, right? I kick. Somebody's going to come. And when somebody comes, I'm trusting because I know that I called, somebody came. Now, there are times, and it could be an environment of drug abuse, alcoholism, could be just physical abuse, homelessness, poverty, all of these things could cause situations where an infant's needs weren't met. And on a continuous basis, nobody picks them up and always their gratification is delayed. Okay. That is mistrust. So, Erickson, I cry, you come, you get me, you change my diaper, you burp me, I get fed, and I'm happy. You don't come get me, I still crying, and I'm still wet, and I'm just gonna lay there by now, because I'm gonna give up crying. Now, Piaget, in the very, very beginning, we call it sensor-motor. And why sensor-motor? Well, sense is touch. They like to touch. Ori is oral. Touch everything in the mouth and then move it around, motor. Sensory or motor. Piaget. It's all about figuring things out. Like I took my finger, put it in my mouth, and I sucked it and I liked it. Nobody taught him how to do that. That was cognitive development. All right. So that just happens. Another thing, let's say they grasp that rattle. Finally, they're voluntarily getting it and they move it. and ooh, it made a noise. Guess what? I'm gonna keep wiggling that and make that noise. And then I might even get it in my mouth because that's how I soothe myself. Okay. This is the schema. It starts with something little and works up into something more. Because remember, at birth, you don't know anything. You don't know how to do anything at all. You have to learn how to suck, swallow, and breathe. Well, now you're learning how to play, basically. It's taking things and making them move and being creative with them. Now, Piaget goes into some more things, concrete, formal, which is school age. I'm not going to go in them yet. I'm not going to confuse you yet. We know that at birth, it's figuring things out, holding it, making a noise, putting it in mouth. It's all about sense, mouth, and moving. And then as we get older, it's knowing that things like this. At 18 to 24 months, what is a toddler doing? Probably sitting in a high chair by now. And you're going to give them a sippy cup to sit there and drink with their dinner, right? And then all of a sudden, one time, that baby hits it, it knocks on the floor, and mommy comes running and picks up the cup, rinses it off, and puts it back on that high chair. You know what that toddler just saw? She just saw how I'm going to get mommy back to the high chair when she walks away from me when I want mommy to be there with me. They're going to throw that sippy cup back on the floor whenever they want because they know mommy's coming. That's pre-operational. Again, concrete. I see it. I saw it. It happened. Now I'm going to do it again. Again, all this learning is they have to see it to understand it, or they're doing it and they're understanding it. Okay. Now, body image. Yeah. Body image. We know that children start with their body image where, let's say, they start to see themselves in a mirror. I mean, there's always a mirror or a glass, something, and babies starting to see themselves in there, and they're starting to be, ooh, who is that person, right? They're starting to, again, that pleasure is all in the mouth, getting themselves how to calm themselves. And then there's something called object permanence. What does that mean? Well, babies are very smart. Once you show them a toy or an object that they like, a blanket, maybe a bottle, maybe something of this sort, right? Maybe, they want to go back to it. Oops, I can't see it. Where did it go? Well, object permanence is even though that object is hidden, they know it's still there and they will actively go search for it. Like at tummy time, you put it like 2 feet away, and the baby's going to try to, shimmy, 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 shake, shake to get over to get whatever that was, that object that they wanted to get. Okay. And of course, they know mom. We know that there's attachment and there's something called separation anxiety. Now, separation anxiety is 3 stages. So what happens if you put a toddler or an infant into a hospital? And it's more of the toddler area. Put him in the hospital, mom has to go home, take care of things, dad couldn't be there, and the baby has to be there for a while alone. What's that child going to do, that 2-year-old? They're going to cry, 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 right? And that's, that where they're just going crazy. Well, after a while, they realize crying's not getting anybody there. Mommy's not coming. So then they sort of regress. They go into this despair where they start sucking their thumb where they haven't done it for a while, or maybe be incontinent when they're potty trained. They regress. And then finally, mommy comes back. They're going to ignore mommy. And why do you think they're going to ignore mommy? She came back. They don't want to be hurt again because mommy's going to have to leave again, they figure, right? So let me not pay attention to them. The nurses were smart. They assigned consistent caregivers to this child. And that's what nursing will do for this child, where there's a certain tech, certain nurse, certain whoever. That's the person who will be there every day, consistently in a row if you possibly can. Now, stranger fear Babies are the type that holds on mom and don't want to let go. I mean, nurses, all we want to do is pick them up, put them on a scale, and weigh them when we first see them, right? That's part of it. And, when they're like about 6 months old, they don't want mom to let go of them. As they get a little older, they're going to start to play, and that's like peeking around, like, let me see who this person is who's trying to get me. We know language development starts with a coo and it ends up with one word by 12 months, whether it's mommy, daddy, nana, whoever it is. And what does a child do from the moment they wake up to the moment they go to sleep? They play with everything. And it could be a cardboard box, not all those toys. It's that cardboard box they like the best. So, toddlers. Now, I call toddlers, it's like having a blender, turn it on, and the lid isn't on. And they're everywhere at once, turn it on, and they're all over the place. That is a toddler. They're very, very difficult to keep up with. It's intense exploration. They want to see and feel and everything. And you really have got to keep your eyes on these children. They are the stage of no, no, me, mine, 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 and they're not sharing. Okay. It's what we call the terrible twos. Now, they're not really terrible. It's just, remember, they're exploring, they're looking at the world. Now, a lot of developmental changes, we don't look at numbers and what's going on. Birth weight quadruples, 2.5 years. All we need to understand about toddlers is infants, we grow really quick. We gain weight really quick. Toddlers don't. It slows way down. We tripled our birth weight at 1 year, right? And now we're at 2.5 years and we've just quadrupled it. You can see how the amount of food that we're eating is really slowed down. Another thing is at birth, infants' heads are bigger than their chest, right? It's part of OB. One of the questions, some of the students told me that was on the essay, that the head is bigger than the chest. Well, somewhere about 15 months, the chest is equal to the head or it's bigger than the head. So there is these changes going on. And by 2, you're about half your adult weight. At toddler, let's talk about things that are going on with them. They're getting more mature. They are getting more independent, right? Getting all sorts of infections and viruses, upper respiratory, ear infections, tonsils. They're getting all of these infections. Well, most children need to be placed in some sort of daycare while parents go to school, right? What do children do every day at daycare? They swap spit with other children, right? They all have the toys and it goes from toy to kid to kid to kid. Understand that this is normal. Even the bestest of daycares, it's going to be part of it. It's just what toddlers do. Therefore, they're giving their germs to everyone. But again, you're building up the immune system and you're getting ready for school and it's making your immune system stronger. Of course, their body temperature, that's been long taken care of. They're starting to be able to move their bowels on the toilet and urinate there too. And the skin now is intact and strong as if it wasn't. Now, gross motor. G, get up and go, 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 movement. Fine motors. F, fingers. It's all about fingers, okay? So, toddlers, you're getting more and more refined. Somewhere between 2 to 3 years old. They used to be waddlers and falling down, and now they're getting in more refined. They are using both hands. You don't know if they're right or left-handed yet, somewhere between 12 to 15 months. And they're throwing balls. And let me tell you, about 18 months, they're throwing it pretty hard. Their acuity is a lot better. Their eyes are working together. Depth perception is there now, unlike it was for infants. Another thing is their sense of hearing, smell, and taste and touch all are developing. If we look at what infant foods taste like, have you ever tasted formula or any of those cereals and whatnot? I think they taste horrible. But infants love them and eat it up, right? Well, as toddlers now, their sense of taste and smell change, and it's better. Therefore, they become picky eaters. Things they used to eat, they're not putting in their mouth anymore. All right? And it has to do with their look, their smell, with their touch, their appearance. Sometimes they're not going to eat it at all, okay? They love to explore food by in their hands, in their hair, all over it. I know that dinner time used to be go for it, do what you want because you're going for your bath when you're done. And we know that that exploration of food and touch is important. Now, Erickson, all about people around them, right? Well, toddlers don't care about people. Automatically mine, me, autonomy. It's all about me. I'm autonomous. It's mine. Now, there are some parents and grandparents that are like the helicopter moms, right? That follow their little toddlers around, making sure they're not going to fall down, hurt themselves, bop their heads, get into things, and don't give them the ability to try. Or getting dressed, don't letting them dress by themselves. Others should put things on inside out, backwards, doesn't matter. It's the attempt that we should do. It's not that, doing it wrong, okay? So that's the shame and doubt. When we don't let them do something, but autonomy, it's all about, I want to do it. Let me try. But somebody's telling me no. As I said, no, me, mine, negativism. No, they know that word. No. Now, toddlers, I think, are the most difficult to have in a hospital, or I know even as a parent, taking a toddler on vacation. Probably one of the most difficult things. And why? They're not on their schedules. Ritualism is what gives them that sense of comfort. Where are they when they wake up? What do you do? What do they eat? Giving them the same food, same schedule, same naps. Toddlers like that. Now, infants don't really care as much, but it's the toddlers that really find comfort with that ritual. That's all about the sensory motor that I just told you all about. Again, Piaget is all about thinking and figuring things out. Well, now they're starting to do different sort of things. They're starting to, like for instance, understanding. One of the things that children are sort of forced to understand is the concept of time. Mommy's going to pick you up later. Mommy's going to get you at 4 o'clock. Say that to a 2-year-old. They don't understand what that concept is. What concept of time do they understand? After lunch, mommy's going to pick you up. After your nap, when you come in off the playground, give them an event, time to an event. They don't understand the numbers. They don't understand a clock yet. That's in the school age these days where they don't even understand these sort of things. And we've already gone over that Erickson, we know me, mine. And then Piaget, it's figuring things out, seeing if things work, which is all about, again, thinking and cognitive. That's more. Again, that's about that sippy cup being thrown off and, yep, mommy comes, so guess what? Now you're going to come every time I throw something on the ground. Now, toddlers, they're starting to understand that mommy and daddy have different body parts. And this comes really from potty training, right? Because they're in the bathroom with you and they can see daddy standing and I'm a girl and I'm sitting, or I'm a boy and mommy's sitting, all of these sort of things. Also, they start with They're touching of their privates. And it's absolutely normal. What I would tell these children, and I know like with little Christian, I would say if he's touching himself, do you hurt or do you itch? All right, well, just go in the other room and itch yourself. I don't need to be watching you. Make it a nothing, but I don't need to be watching them itch themselves or touching themselves, right? It's their part, it's their property. They can do what they want with it, but I don't need to be watching. We know that there is playing house and mommies and daddies, and we know that girls like daddies, and we know boys like mommies. So part of understanding males and females, it's a part of it. We know with toddlers, if we give them their teddy bear, their pillow, their jammies, or something, this transitional object is going to help them through a hospitalization or even a procedure. Their language is getting more and more and more. Now, the problem is toddlers understand more than they can verbalize. So it's frustrating for not only toddler, but for parents. So I would always say, do you have another word or can you show me? And that can help them. Their personal behavior, they're getting more independent, right? Me, mine, I do. They want to feed themselves. Well, what if the spoon is upside down and backwards and they're trying to feed themselves? Should I change where that spoon is? Put it right side up the right way? Oh, they're experimenting. Let them try. And they'll eventually get the spoon correctly, okay? And dressing. It might be backwards today, but once we go and we help them with something later on, it's going to be the right way and it's okay. Again, trying to give them the independence is what they need. And now toddlers are starting to understand other people. For instance, mommy don't feel good. Maybe the little toddler goes, gets their favorite little stuffy toy, gives it to mommy. Here, it'll make you feel better. Toddlers are starting to understand this thing. Play, 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 play. We know play is really important. We know that parallel play is what they do. They play next to each other and they don't share. That's a toddler. Potty training, there are those 3 readiness signs where they are not urinating in their diaper for 2 hours. We know they're ready. Remember, stool, bowel training comes before bladder. They can feel that stool in their rectum easier than urine, okay? We know there's sibling rivalry. We know there are temper tantrums. What they say about temper tantrums is they're having one, let them have it by themselves, don't pay them attention, as long as it's not hurting themselves or others. When we feed into that temper tantrum, they're getting the attention that they're looking for. So they're going to do it again. Negativism, as I said, no, me, mine. And again, when they're stressed, when they're alone, mommy leaves, or they are going to regress. That's how they deal with stress. Nutrition, right? Nutrition. Toddlers don't eat that much. They eat very little. 1 tablespoon of food per year of age is all they need to eat. And we think because they ate so much as infants, because they were growing like crazy, they need to eat the same, and they don't. Remember with nutrition in some cultures, and they don't, let's say that's all vegetarian, remember, they might need vitamin supplements if they're not getting all the vitamins from nutrition that they need. It's something to remember and to think about. Know that whole milk is good for calcium and vitamin D. So that would be something that we know that they're getting their calcium and vitamin D. And then remember, protein is always good for wound healing. I think toddlers are always falling down and hurting themselves, right? Protein can help them heal better. Many families have their own complementary medicine. As I said, my husband, who's Jamaican, loves ginger garlic tea, hot tea. And he puts those big things in a pot and then he will strain it and you drink it. And I'm telling you, you do feel better the next day. But again, knowing some of these can affect with normal medicine. So always be aware of that. And sleeping, we know not all kids sleep, and we know there's night terrors on these children at this age too. Again, dental health, flossing when we can, and we're using toothpaste now. And again, getting them to the dentist for checkups. There's all different ways of getting poisoning. Lead poisoning is one of the big ones. It's gone down a lot because it used to be paint in the old homes and the windowsills and children biting on it when they're teething and getting iron from the paint and then getting lead poisoning. That lead, the paint from the 50s, 60s, and they were getting it. So if there's a problem with iron, we do something called chelation therapy. It's almost like a dialysis, but it only pulls off the iron. It doesn't pull off cells or doesn't pull off like urine and stuff like dialysis. It just pulls off a cell. And that's called chelation therapy. Or we're going to give them medications that can combine with the iron and you urinate it out. Know that kids get into everything. And if they do, number one, they need to call poison control. And they need to get to the ER now. Especially if it's things like mommy's cardiac medicine or Tylenol, acetaminophen. All of those things can have some big problems. So again, calling poison control. We don't believe in EpiCac and vomiting today. So whatever poison control says is the most up-to-date information on how to treat that sort of ingestion. Again, safety, what's number one? Any age, it's going to be your motor vehicles. We know drowning is up there, burns, pulling things off the stove, falls, jumping, missing the other couch, falling on the floor, banging their heads, getting into things, suffocating, bags, whatnot. And again, just they're have not been hurt before. They don't not to know not to do it. So these children do get hurt. That's toddlers. Remember, car seats. If it's older than 10 years old, we can't use it. And if it's been in an accident, we can't use it. These are things that do save children. Remember, rear facing for first 2 years of life or 30 pounds. And then it can go to front facing in the rear seat when they are at the 2 or the 30 pounds. Okay. Car seats, very, very, very important. So we did the gross motors. And now preschoolers, ages 3 to almost 6. At 6, they turn into school age, okay? Now, what happens when your age is 3 to 5? Well, you're growing up, you're starting to learn, you're going to preschool, right? You're getting ready. So parents should be reading to these children, getting them excited to learn in school, being around other children so that they're used to sharing and being with other children. Remember, children don't have big attention spans. It's usually you got 15 minutes and you're lucky if you get that. Preschoolers, again, still growing slowly. There's nothing ever like the infants ever again. Slow. And remember, this is part of the body systems maturing. Your lungs, your bladder's getting bigger. You can hold it longer on longer trips. All of these things are important. Gross motor, get up, go, go, go. Walking, running, climbing, jumping. Fine motors, F, fingers. We can dress, button a button on a shirt, drawing, coloring circles, using scissors, all of these things. Now, Erickson. Erickson, again, is a sense of initiative. Now, what this means is now they have seen things in life. So they try to do things like maybe they want to empty the table after dinner. And maybe they made a mistake and they dropped the plate because they shouldn't have gotten the plate. They should have gotten the plastic stuff and not that one. Well, oops, that was my sense of initiative. I wanted to try, but I didn't do it right. Or I got it to the sink, but someone corrected me. feelings of guilt, anxiety, or fear because you didn't do it the way they thought you should. That expected behavior, okay? Again, it starts with, and Erickson has this super ego here, and it's your conscience. You start to know when you're doing wrong things at preschooler. Now, infants and toddlers don't know that. They don't know right and wrong yet. It is now in the preschoolers, when they do something wrong, they know it. They're getting ready for school. They're going into school. We're reading. We're going to be in activities with other children. Like I said, their language is getting better. And we're starting to think more magically now, as in trees have leaves to protect them from when it rains. Or I slipped on the stairs and the stairs was bad. It made me slip. I gave life to a stairs or to a tree. It's thinking, being magical here, okay? That's what that means, all right? They are understanding the right and wrong, and there is a consequence for it. And now, again, they still don't understand time. Again, it is after lunch, dad's coming to pick you up. All right, same thing. Again, starting to learn, starting to think, starting to make things the way we want it. Now, Kohlberg. Kohlberg is all about morality, right and wrong, and a consequence. Preschoolers, reward and punishment. Younger than that, they don't get it. But at preschooler, we start the reward and punishment. It's wrong, something's going to happen, a consequence. And if you're right, well, maybe it's a good consequence, right? You're starting to learn it. Body image. Now, this is basically what we call the age of band-aids. Preschoolers feel that if they're cut and they bleed, their insides are going to come out and they're going to die. And a band-aid, you put it on it, and oh, everything's all better, isn't it? It's just part of what they think. And again, why do you want to know these things or understand it? Well, if this child's in a hospital and I have to stick them or suture something up, they need to know that their insides aren't going to come out, that, that you're going to sew it up so nothing can. If they need to have surgery, they're afraid that they open them up and, how are they going to get those things back in there? Again, giving that child an ability to ask those questions. Preschoolers are pretty smart, but they're really scared because they just don't understand. So they're going to look at you for that. Spirituality is they know what they've learned at home. They're not really understanding others yet. All right. As in the difference, for instance, Christian faith or Jewish faith or another faith, they're all different. We all have something we believe in, whether it's doing right or wrong, or if whatever your God's name is, there's some sort of religion that every child learns, or what spirituality from their home. Okay. It is from their home, as in almost like a right and wrong type thing. Now, preschoolers, for instance, they come in, they fell down and they broke their arm on the playground. And they go, I broke my arm because I hit my sister yesterday and I shouldn't have done it. Well, why are they saying that? Well, preschoolers feel that they are being punished for doing something bad to somebody else. Crazy, huh? They really think that I hit my sister, so therefore now I'm being punished with a broken arm. Again, sexuality, I've already talked about it. Girls like dads, boys like girls. And now they're starting with that sexual exploration, even sometimes even masturbating. If they're doing those things and they're in a room with people, it's like, okay, could you just go to your own room or get your hands out of your pants? Again, it shouldn't be made to feel like it's a bad thing, but it's the wrong place to do it. Social development, that separation individual process completed, they're easier to leave mommy. They know they're coming back, they're going to daycare, they're going to dance class, whatever it is. They're getting over that. Um, in hospitals though, you have to get them in there or they're going for outpatient procedure. Having that doll, that truck, that toy, that pillow, that security, that familiar object really does help with those fears of those young children. Their languages get amazing. They have all of these words that they make up. I know the word that my little grandson used to like the word was teleportation. He liked everything. I'm going to be teleported here, and that's a teleportation. And I'm like, all right, whatever you say. But again, it's being creative and thinking and using words and communicating, and it gets more and more and more. And they're understanding what those words mean as they get older. They don't need to be as ritual as toddlers. These are easier to go to a hospital, easier to go on vacation. So they don't need to have that same routine, that ritual like you have at home. They can dress by themselves and they want to please you. They know what's right and wrong. They know what the family is. And the one time that they like to challenge the code of conduct is usually bedtime. They still fight. No, Auntie Kenny, Auntie Sandra's here. I don't want to go to bed yet, right? Those things are sort of things that you're going to hear. And it's going to come to the point where no, all right, it's time to go to bed. They're going to challenge it. Now, play. These are things you need to remember. Associative play. These are preschoolers. This is two or more children playing together, but there's no rule. There's no who wins the game. They are doing things together, but there's no rhyme or reason with it. Imitative is you imitate somebody else what they're doing. Imaginative, well, of course, these children do have their little imaginary playmates and they're talking as they're talking with their toys and their trucks and their dolls and their Spider-Man. And this is all part of what they do. It's that magical stuff going on, right? Dramatic play is where you had an experience in a hospital and you want to know what happened. If you do it through play, you're not threatening now. And they could show you maybe it was the IV they started, you didn't like what happened. So that's dramatic. And mutual play is just playing together. Preschoolers don't like dark. They need a light on. No, come with me. It's dark up there. There's a boogeyman, right? They don't like to be left alone. They don't like large dogs. They're afraid that they're going to eat them up. They're afraid of ghosts. They're afraid of castration. Something's going to happen to me down there. And look who they're afraid of. Objects or people associated with pain. That's us. We've given immunizations every time they come, or drew blood, or swabbed their nose, or their throat, or did a urine, or guess what? We are the bad people. So we have to get that out of them that we're not bad. So sex education. One of the things that we need to know about sex education is we need to just sit there and talk. We need to find out what does the child know first, because sometimes we give too much information, all right? And the one thing that they do say is to use anatomic words that are correct. My grandson knows a penis and a vagina. Now, his cousins know different words, but that was one thing, that mommy wanted. Okay, what you want is what we're going to use. Always be honest, if they're asking questions. And as I said, that masturbation starts and it is a private act. And that's the only thing that we need to tell them. Not say, oh, that's bad. Don't touch yourself. No, go in your other room. I don't need to watch you see you do that stuff. So speech problems. Sometimes we get to ages 2 to 4 as we start seeing some delays, not having enough words or pronunciation, stuttering, stammering, etc. And when we talk about speech problems, the first thing that we're going to check is hearing. If you can't speak well or are garbled, maybe it's your hearing, all right? Or, that can help with them learn speech better. And of course, anytime there's a delay, there's always early intervention, speech, physical, occupational therapy, all those things. As I said, sleep problems, going to bed, preschoolers, they don't want to. Again, some sort of bedtime routine, maybe read a book before or have a little show you watch and it's quiet time and it's that slow down time. And yeah, night terrors, sleep terrors do happen. I did have my second grandson had night terrors, would wake up at night screaming. And it was just something that I had never seen it before, but he did. Injury prevention, again, number one, cars, making sure they're in car seats, booster seats, whatever it has to be. Again, always education. And then if the child's out with roller blades, bikes, skateboards, any of that, make sure the children have the proper equipment. Children falling down and hitting their heads can cause permanent damage, and we don't want that. So with children at this age now, they're getting old enough to help themselves. They don't need us watching, being the helicopter, making sure they're not getting hurt. So again, education, education, and letting them ask questions, okay? We know that peers in school are very important because they ask those questions together. And we know the kids going to school is a great thing for them. Communicable diseases, we know that there's a lot of them out there, upper respiratories, all your viruses, chickenpox, one of the big things. One of the things that as nurses know, whenever we're placing any child or any patient into a room, knowing what immunization status is so that we're not going to give that possibility of giving somebody else a disease that they don't have. And the one big thing, hand washing always is the big thing to prevent. Conjunctivitis, big thing with kids, because again, it's everything in their face, everything in their eyes. Again, it's washing their eyes, putting ointments. Remember, ointments will make the vision blurry. Make sure that they know about it. And hand washing. Also preventing that infection. Changing their pillowcases every night is something we don't think about. Having sores in the mouth, again, they hurt, making sure that we prevent that spread of infection and get medicine for it, and hand washing. We can have all sorts of parasitic diseases. We can have pinworms. We can have roundworms. Again, these are things that children go in the yard. It gets in their fingernails and they eat and then they eat their fingers and they get the eggs into their system. Now they have pinworms. And what you see with the pinworms is you're going to see them start itching their perineal area. And that's where we do that Scotch tape test. And we find that pinworm and we can give them medicine. Remember, anybody who has pinworms or and the family has it, you need to treat the whole family. Most likely everybody has it. Child neglect is one of those things that nobody wants to talk about. I've seen a couple really bad cases. Now, I've not seen one that's being hit with a belt like this one apparently is. I've seen one that head was smashed in a shower stall. And that was a 3-month-old, twins, both of them. I also seen a 6 or 7-year-old boy who was starved, came in, had absolutely no fat tissue on him, and he coded when he arrived into the ER. And we did save all those children, and we did make sure that they were placed in situations that were safe. Again, remember, children, your responsibility is to make sure that you have any suspicions, report it, okay? If you report it, you know that you'll have somebody can take care of them and get them into a place, a more loving environment. Probably the hardest thing to watch, child abuse, neglect. There's something else called Munchausen syndrome. I don't know if you've ever heard of it. This is a syndrome where a mother tries to keep a child sick. because they like the medical attention. They do things like taking toilet water, inject it into IVs, having a wound and putting stool or mud or dirt in it. They do all sorts of, I can't even imagine all the things that they do. What is your job if you suspect Munchausen syndrome? Well, your first job is protect that child, right? So number one, anytime a parent goes into that room, somebody needs to be there in the room with that child. And anything brought into that hospital must be inspected by the medical staff before we can give it to the child, okay? So Munchausen, it is serious, and they do really do bad harm to their children. So again, our goal, protect the child. If we suspect it, make sure somebody's in that room if that parent's there. All right, we've already gone through that. So the parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most important response by the nurse? So 3-year-old, boy and a girl in the bathroom, they're cousins. Oh, he's got a penis. I don't. What's going on here, right? So what would you do? Isn't this normal? That curiosity?
Yeah.
So you neither condone it or condemn it. You say, come on, let's go, or let's get something to drink, or let's go outside. You just stop that attention towards it, okay?
Mm.
Hey, let's go for a cahoots now. There are a lot of cahoots today, so I'm going to try to go through it as quick as I can. But when we talk about
Can we have a
infants,
bathroom break real quick?
go ahead, go ahead.
Thank you.
We'll take that couple minutes as we start for the cahoots. Not a problem at all. Please. Um, Another cahoots on infants, preschoolers, and toddlers. Probably all of the most concepts of changing and things, and they're all really mentioned into that cahoot, okay? So let me just pull it up. You guys can start getting yourself set up, and when they come back, we'll get going. There are 60 questions, so there's quite a few of them.
Mhm. I got no further discussion for this week. And so I'm gonna finish my endocrine. I'm gonna do my discussion board, and then my homework will be done. And then, really,
So has everybody had a chance to freshen a little bit? Anybody else want to come? All right, let's just get going so that we can get done today.
Wait, I'm not.
It's okay. Just look at it. Types of play considered to be sense pleasure play. Sense, remember, sense is touch. Children have a lot of issues with like textures. Sometimes it's in the mouth, sometimes it's the touching. They just like to touch it like crazy. So sense pleasure would be what? Everything but checkers. Yes, it is. In the sand, finger painting. And then, as I said, that dinner time, let them play with their food. It's really part of growth and cognitive development. The nurse notices white patches in the mouth of an infant that cannot be removed with a tongue blade. What would you do? Apologize for the bad spelling. And you will notice what I can't cover in class, you're going to see these questions on a Kahoots that can help you. Now, infant, white things on the mouth, that is called thrush. Thrush sticks to the mouth and it is actually painful. What we need to do is put some medicine on there. But how do we put medicine on an infant's tongue? Do we squirt it in? Do we pour it in?
You put it
No.
on the pacifier.
You take and put it on a Q-tip and swab it on the tongue. And then it gets exactly where it needs to go because they can't swish and swallow nystatin like an adult, right? They could just have enough to stick on their tongue. And that's all we do. Very good. The pacifier was always a question that students do try to pick, but it's that swab that's the answer. What type of play is considered cooperative play? So cooperative play is two or more children playing together with a goal. Checkers is absolutely one of them. Building a house, building a race car, building a sandcastle. There's something that's a goal. It could be any of those. Very good. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning what? What is morality? What does Kohlberg say? And it starts with preschoolers. Morality is not infants or toddlers. They don't get that yet. Remember, toddlers are all about me. Infants don't understand, but preschoolers are now aware of the environment. Right and wrong and a consequence for each. Good, bad, and consequence. Excellent. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? So a child has to come in and have surgery. Well, whenever we're going to be talking to any children, number one, we get below them. We don't stand above them. Number two, we get on the child's developmental level and explain the procedure. And then we use a doll to show them the areas or what's going to happen on the doll. Okay. So, number one, get below them. Number two, get that rapport. In preschoolers, I mean, using play, asking them about school, tell them that those little lighted sneakers are cute, the freckles, the big blue eyes, something. And that opens up something that the children do really warm up to, okay? So again, dolls are a great way to explain things. Before performing a physical exam assessment on a toddler, the nurse should do what to encourage cooperation? So you need to go listen to the lungs and the tummy and whatnot. How are you going to do that? So again, you're going to get down below them. You're going to open rapport, minimal contact at first, right? Then you're going to use play, let them touch the equipment. I think one of the big things on toddlers is that darn blood pressure. They can't stand it. So I have them pushing the buttons, and now it's fun. And now it's fun. And they're going to do it and not be screaming and yelling, okay? Minimal contact, and then you work it up into what you need to do. Remember, children are never a head to toe assessment, ever. Adults are, not a child. What would you suspect if you note that an infant's chin is quivering, their fists are clenched, and they're inconsolable? What's this mean? Remember, infants can't tell you what's going on. This is why I love children. You have to have great, good, keen assessment skills. And it's just really telling you pain. Now, if they were like that and then they were banging an ear, probably ear pain. That's your location. Or sometimes a hand down the throat is telling you the throat hurts, telling you location. So just by those little things, I have said, this child's in pain. Oh, they're banging their head too. Let me look at that ear. A multi. Erickson describes infants as trust versus mistrust. What does trust mean? So an infant who has trust knows that they're happy because all their needs are met, so they're secure. They predict what's coming, their needs are met. They're calmer and they are happier. That mistrust is they cry a long time and it actually gets to the point where they stop crying, they give up. Okay? So it is that trust we want to give our infants. A 3-year-old child's having an outpatient procedure. How would you help the child to be less fearful? So again, this is number one. Sit down below them. Don't tower over. Open that rapport, whichever way, and then use that doll and let them explain. And let them ask the questions. Very good. A multi. You need to do an assessment on an infant. You walk into a room and the infant is asleep in the mother's arms. Are you going to do an assessment? What are you going to do? Infants asleep. So absolutely the best thing to do and when to do it is if an infant's asleep, you're going to listen to their breath sounds and their heart sounds. When they're awake, what does an infant do? They move and how are you going to listen to those heart and to those breath sounds as well as you could? So usually that's the first things I listen to because their infants many times are asleep in mother's arms. And then as they wake up, if they're crying, come back and do it in bits and pieces of the assessment. So again, sleeping infant, do breath and heart sounds. When do you switch formula or breast milk to whole milk? And remember, it's not 2%. Children need fat in their diet for their central nervous system cognition up to the age of 2. You're not going to hold it, even if the child is overweight. It is at 12 months old. Very good. A multi. When teaching about car seats for a newborn infant, I think the hardest thing that I saw is I had a Christian was 2. He weighed 25 pounds when he turned 2. Do you turn the car seat? That was a question. And you know what the answer was? Yes, you put him front facing. It's the age and the physical agility. It wasn't the weight. But at age 30, at 30 pounds of weight, you would turn him around also. So he was way too little, but we still turn him around. So we're not going to use him at 10 years old. That's way too much. New car seats, rear facing or gently used. When and how do you introduce solid foods to infants? I still say that looks like my son after dinner every night. He used to have so much fun. So when we're introducing food, it's one at a time, wait 4 to 7 days in between, okay? What's the first food that we could introduce with least allergenic? Rice cereal. Before assessing a 4-year-old child, what techniques would you use to approach this child? As I said before, approaching a child, number one, you get below them. And then you just open you break the ice, as in they're wearing a Batman shirt. And oh my God, it's my favorite too. Or maybe I have a sticker of Batman in my pocket. I always had stickers that I carried for children that they could have. Or it's that curly hair, or it's the freckles, it's the blue eyes, it's the lights that are sparkly. Oh, those are really cool. These sort of things make that child feel individual and special, and all of a sudden they will start warming up to you. Again, don't lie, because once you lie, you're done. What technique can be used to examine a toddler? And this is the age where we use play. And it really does help. Now we make it fun. It's not anything that's serious now. And a toddler, they can play really well. When assessing a healthy child's lymph nodes, what would you expect? A healthy child, the lymph nodes, what would you expect? Shouldn't be able to feel healthy at all. They should be nothing, okay? So if you feel nodules, there's an infection going on somewhere. That's your lymph system. Which Erickson stages of developmental levels would be used for a toddler? Erickson, psychosocial, talk about people around them and how you deal with them. Toddlers are what? Me, mine, I do. Leave me alone, right? And that's autonomy versus shame and doubt. Excellent. Very good. What pain scale would you use on a 3.5-year-old child? During this course and on your HESI, you will see pain scales all the time. You'll see faces and you'll see FLAC, and you need to know when they're used. Remember, with FLAC, it is also nonverbal children also, okay? And it's up to age 3. At age 3, it becomes faces. Very good. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So, autonomy is I want to do it by myself. Okay, and they want to try it. They don't want anybody to help them. That shame and doubt is when somebody stops them, grandma, mom, dad, whoever. Let them try and just be there, and don't let them do things that'll be harmful to them. A 2-year-old boy is playing with mud and dirt. What type of play is this? And that sense pleasure. Very good. A parent of an 18-month-old boy says that he says no to everything and has rapid mood swings. Parent says, is this normal? What's going on here? Absolutely normal. Very good. What is descriptive of the preschooler's understanding of time? Times are with events. After nap time, daddy's coming for you. Excellent. An infant's crying and shaking their head. What feature of pain is the infant showing? And that's your location. Very good. A 1-month-old infant's back of their head is flat. What would you tell the mother? This is always the concern today because we say, your infant has to go on their back to sleep. And mom's like, but the back of the head, there's no hair and it's flat. I want my baby's head to be flat. And what we tell them is tummy time. 2, 3 times a day for 10 to 20 minutes, whatever the kid tolerates it. Put them on their tummy. It will round that head out. A newborn's mother has type O positive blood, and the infant has type B positive blood. The infant's at high risk for what? So you've got a mixing of blood here, and this is specific to newborn children. Has to do with mommy's blood and daddy's blood and coming together, and we have a concern at this point. And it's called hyperbilirubinemia, and it's basically the liver cells explode and the bilirubin goes into the body. Bilirubin, if it gets too high, can cause brain damage and seizures. So how do we get rid of hyperbilirubinemia, or how do we prevent it from the get-go? Well, the biggest way of getting rid of bilirubin is through the GI tract. Feed them, especially breastfed. Breastfed tend to have more stools than does the formula. Feed them, let that bilirubin come out in the stool. And then, of course, there's the lights, and then there's sunlight we can use. Which intervention may decrease the incidence of physiological jaundice in a healthy term infant? So remember, jaundice is the GI tract. It's holding on to it. We need to purge that GI system and get rid of the bilirubin. So early and frequent feedings, let's get that GI tract moving. Let's get rid of it quick. And it works. Which intervention lowers the risk of sudden infant death syndrome? So we want to put them on their back, and that's it. Not too hot, no smoking, and if the mother's breastfeeding, it's even better. Infants crawl before they walk. This pattern of growth and development is called. It's called sequential trends. It's just in sequence, this is what happens. And remember, sometimes they're going to go from sitting to walking. Sometimes they miss things in between, and that's okay, as long as they're going forward in the development. How do you communicate with parents that do not speak a language that you know? How do you communicate with them? You know, I moved down from New York and I knew no languages. I took a little bit of French in high school, but nothing else. So they had those little blue phones and use them. Now, sometimes you're going to have an older brother or a family member with them that says that they can do that interpretation. Guess what? They'll put their own feeling on that interpretation. It is better to do it with a telephone interpreter so you get exactly what the parent says and not the interpretation of that family member or child. Okay. What age would most children could understand under, on top of, besides, in, back of, around, over, next to? And it's at 4 years old. Very good. You know, sometimes it's earlier, but it's like, you know, your shoes are underneath the couch and they can go find it. In terms of language and cognitive development, a 4-year-old child would be expected to do what? Cognitive development, understanding. Hmm. So a 4-year-old should be able to follow simple commands. Here, take your clothes, go put them in on your bed. Here, get undressed and go in the tub. I'll be right there for your bath. Take your shoes, put them by the front door. All those simple little things, the 4-year-old should be able to do. What pain scale would you use to assess the pain of a toddler? And toddlers and nonverbals are flack. At age 3, it goes to faces. A multi. What safety instructions would you teach the parents of a 6-month-old child? So with safety, you have to think 6 months old. What can a 6-month-old child do? So we lift their head by 3 months. They can roll completely over by 6 months. So guess what? I need to be very careful putting them on a chair, on a table, on a bed, on a changing table, right? We need to make sure that they are locked in or my hand is on them at all time. Car seats, yes, rear fairing, and covering those electrical outlets so they don't stick their fingers in there. But the big thing is with safety on a 6-month-old is now they will roll and fall off. I can't tell you how many young infants I've taken care of in the ER that have rolled off of beds, changing tables, couches, coffee tables, dining room tables, oh, kitchen counter. I mean, they've rolled off and onto the floor. A multi. The cognitive characteristics of a child, 2 to 7, in the pre-operational stage. So remember I told you you have a tree who has leaves and they're like the umbrella that protects them. We have stairs that made them trip. So bad stairs, you made me trip. It is, they use object to represent something else. Getting on the broom and riding it like a horse, putting your arms out and being like an airplane, woo, and going around the room, right? They don't understand anybody else yet, and they are imaginative. Logic actually doesn't come till adolescence, according to the theorists, all right? Logic is all concrete, means they have to see it, understand it to know it. It's not logical. till adolescence. A nurse receives a phone call from a mother about her 6-week-old baby. He's crying a lot every day. What can she do? So what would you tell a mother? She called the doctor's office. Kid's crying a lot. Kid's only 6 weeks old. Remember, at 6 weeks old, there is no immune system on this infant, only what mom's given them. They're very brittle. They need to be seen as soon as they possibly can. It could be just simple an intolerance to food. It could be, the baby's eating too much, too little, wasn't burped correctly, all those things. But you can't assume that. And at 6 weeks old, you've got an infant who's immunosuppressed and at high risk to get sick quick. So this is something we have to remember. A multi. What should an infant be able to do at 9 months? So at 9 months old, they should be able to hold that rattle, pull themselves up on the feet, right? That's the creeping thing. And then by 6 months, they're rolling completely over. Sitting without support is that answer, not with support. That was a tricky one. The first expected fine motor developmental milestone for an infant begins with what? Fine motor, F, fingers. Remember, gross motor, G, get up and go, 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 movement. That's how you remember those two. An infant, what do you do first? An infant is that reflex palmar grips, then it goes to the voluntary, then it goes to crude pincer, neat pincer, then putting objects in or out of a container, and then blocks of two. It's all the fingers. That's the first year of life. A 2-year-old has difficulty in activities, has sensory sensitivity, and has only speak one-word responses. Can you assess this child? What's going on? We know that they should be able to talk. They shouldn't really have all of these sensitivities. Something's going on here. Now, we're going to go over it more. I believe maybe it's week 4, test week. But these are things that are telling me a kid is possible autistic, autism. We do not diagnose them to up till age 2. Before that, we can have telltale signs, but we don't ever give them that diagnosis to age 2. Now, every hospital, every place has their own checklist, but just know there are checklists that you can check that can prove that, yes, this child could be autistic, and then get them to what they need, the proper help. A multi. Parents are concerned our 8-month-old child's not developing like their older child. What's normal for 8 months? You know this one really well. So by 8 months old, they should be rolling completely over, absolutely, and sitting alone unsupported. Locks into container, that's 11 months. And first steps is right there at 1 year old. A multi. The mother of a child is suspected of having Munchausen syndrome. What should be in the care plan? Part of your nursing care plan of a child whose mother is suspected of Munchausen syndrome. What do we need to do? So remember, Munchausen is a type of abuse. And our job as nurses is to keep the child safe. So the mother needs to be supervised when the child. They also need to monitor any items brought in. Now, you don't have to have somebody stay in the room at all times, no. But it is nice, especially if there's going to be periods without a mother, to have the same CNA scheduled, if at all possible, to take care of that child. So consistent nursing staff is something that could be, but doesn't need to be at all times. What fine motor skill is expected of a 4-year-old child? Remember F fingers. What is fine motor? So when you look at this question, there's two things that are gross motor: get up and go, walking and skipping, right? Tying shoelaces or buttoning a shirt, which is a 4-year-old. It is buttoning a shirt. Tying shoelaces is more like 6 years old. It's a little bit farther advanced. A multi. What gross motor skill should a 4-year-old be able to do? So remember, gross motor is a G. Get up and go. It's something to do with movement. So by a 4-year-old should be able to walk upstairs with both feet, hop on 1 or 2 feet. Absolutely. Jumping rope is more like 6 also, okay? And tying shoelaces, fine fingers. It's a fine motor skill, okay? It's not the shoelaces. RN doing a developmental screening on a 10-month-old should expect which fine motor skills? 10-month-old should be able to do what? So a 10-month-old should be able to grasp that rattle voluntarily, and they should be able to use the pincer grasp, whether it's screwed or it's, a fine pincer. Frequent developmental assessments are important for which reason? Why do you look at if they can lift their head and turn over and grasp rattles and need to know these sort of things? We know that certain things are going to happen, and if they're not, they're going to be delayed. So if we see a delay or a deficit, or they're not lifting and they have a head lag and it's 7 months, and they should have their head okay by 3 months, they need something. So what do? It's called early intervention. We're going to give them speech, physical, or occupational therapy. Whatever they need, we institute it. And you know what's great about children? They catch up so quickly. Children catch up quicker than adults do. The natural physical developmental sequence that most children follow is, what do they do first? Physical or gross motor, I would call it. Yes, and it starts with the head. Head, turn over, creep, crawl, cruise, and walk. A multi. Which would alert the nurse to hold the digoxin on an infant she's caring for? Well, what is digoxin and what are things you know about it? Just because it's a child doesn't mean we're doing anything different than an adult. All we do is give mics per kilo per dose. So infants' heart rate should be over 100 at the minimum. So a heart rate of 90, a dig level, which is toxic, or a low potassium level are the things that we look at, just like we do for adults. That bounding peripheral pulses has nothing to do with digoxin, okay? Now, why would you worry about digoxin in an infant if we didn't have any of those levels? Well, if you have an infant who's on digoxin and who starts vomiting, that could be dig toxicity. What would you do as a nurse? Hold the dose, tell the doctor, and do a dig level, and making sure that the vomiting wasn't due to dig toxicity. In general, an infant should triple their birth weight at what months? And that's at 1 year, 12 months. When an infant's toes spread, when the soles of the feet are stroked, this is called, they spread, they splay. Same thing as adults. Very good. Can you prevent otitis media in infants? One of the big things is actually that exposure to smoke. You know, we know that being breastfed also can help, and then sitting up after feeds. But the big actually thing one is that exposure to smoke that really can cause that otitis media in children, in infants. When entering into an infant's room, the door slams shut. The infant jerks and starts to cry. What is that reflex? What is it called? This one. The hands and the feet come up and they, you scared them, right? You slammed the door on them. And it's either called moral or startle. It's the same thing. Moral or startle, you can use the same word for it. Is it a normal response? I guess so. But what is the name? What is that reflex called? It's moral or startle. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? I mean, this is probably one of the biggest things, especially when I worked in the ER and we had to give a dose of medicine to a child. Who doesn't want it? So we had to learn tricks, right? And one of the big things is we say is just to use a straightforward approach. And what does that mean? Well, you have a 4-year-old. Do you want to chew a pill? Would you like it in a cup? Would you like it in a spoon? You want the orange medicine or you want the red one? So straightforward, that's what you get. And when you're done, what do you want? A glass of water or a popsicle? I mean, this is what you do, straightforward approach. Some kids don't like medicine. Which intervention helps a hospitalized toddler feel a sense of control? What do we know about toddlers and what do they need? You have to follow the same routines, the schedule, that ritualism, those routines. You do the same thing, the kid feels comfortable, they know what's coming next. Very good. A 3-month-old infant does not sleep through the night. Finding is most significant. What would cause an infant not to sleep through the night? You know, and it's just as simple as the baby has a diaper rash, and they do really hurt. And there's all sorts of creams and ointments and et cetera to use. But diaper rashes, they will be awake once they urinate or stool. So an RN is assessing a 2.5-year-old toddler. Which finding should you report to the provider? So which one of these aren't right is basically what it's asking. So this is the head and the chest. So somewhere a little over a year old, the head and the chest should equal it, and the head should be smaller than the chest. Not something's going on. If it's still big, is there hydrocephalus? Is there brain tumor? What's happening there? A multi. What are risk factors for SIDS? So males more than females. Smoke is always there. And then any recent illness that may be some little mucus in the nose that is impeding upon breathing, sucking, swallowing, and breathing. And we know breastfeeding decreases the risk for SIDS. What does the rooting reflex and enable the infant to do? What is rooting all about? When you take and you stroke the side of their cheek and they go looking. And when you stroke their cheek, they're looking for breast, they're looking for bottle. And this is the way we start them from, oh, I need something. Let me find it. And then they start the sucking. A multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, I put these acid-base questions in. There was one HESI that had 4 acid-base questions in it. So, diarrhea. Diarrhea is full of alkaline from all of the digestive materials and enzymes. So you're losing alkaline. What is left? Acidosis. Also, as you're getting rid of all of this alkaline, you're getting rid of potassium too. Very good. You guys did pretty good here. Now, if I was vomiting, I have stomach acid. I'm getting rid of the acid. What is left? It's alkalosis. So, diarrhea is acidosis, vomiting is alkalosis. And you always worry about a decrease in electrolytes. Very good. Normal language skills for a 3-year-old child. And always know that they understand more that they can express at this age. And they're going to use some words in manners that you never heard of before. So they're about 4-word sentences right now. By one, they're in 1 word, okay? So 2 words is not enough yet, 4 words at least. An infant is NPO due to their medical condition. What is important to remember? Many newborn infants are born and they're in respiratory distress and they're not able to eat at all. I mean, infants still need normal growth and development. They still need to be able to soothe themselves, right? So it's that non-nutritive sucking. It's that pacifier, non-nutritive sucking, and it soothes them. And that's what we need to do. We're not going to put anything in their mouth. We're not going to do mouth care. We're going to give them a pacifier. And last question. What should an infant do at 3 months? So they should be able to lift their head up. 5 to 6 months, they're rolling over. Very good, guys. Let's see how we did today. Number 3, Io, good job. Number 2, Degeneria. Very good. Number 1, Vincent. Good job, Vincent. Vanna and Stacy. All right, this is the end of week 2. Remember, there is no school next week. I'm going to be sending you, probably as I send you the recordings today, I'm going to be sending you the recording for next week. Remember, in that recording will be the cahoots. I'm going to send you all of that information. you'll have it, but you're going to have to look at it at your time in order to get the information you need, okay? But you'll be getting that as soon as I get the recording today. I'll be sending it to you. Remember to think about a diagnosis that you want to do your pediatric assessment on. Asthma, ADHD, autism, I've seen tonsillitis, Kawasaki, and there's all sorts of things. Something that's interesting to you. Remember next week, have a good week. Any problems, let me know, and I'll be sending you information. Thanks, guys. Have a good day.
Thank you. Have a good
Muted
afternoon.
me back.
Thank you.
I have a question.